Hello, everyone, and thank you for attending today's webinar with the Global Rural Nursing Exchange Network. I'm going to just wait a few more moments while I wait for everyone to click on. All right, hello again. We'll probably still have a few people trickling in here, but thank you for attending today's webinar. Before we begin, I'd like to go over a few things. You will be muted throughout the entire webinar to help with any noise. If you have any questions throughout, we encourage you to please type them into the chat box. Questions will be answered at the end, but we will be monitoring the questions along the way. So if you need anything, just let us know. If for any reason you're unable to attend the webinar all the way to the end, the session is recorded, and so you'll have access to that from our website. Today's Subjects That Matter Most webinar is Public Health Nursing's Role During the Coronavirus Pandemic. Our presenter, Audrey Snyder, is an associate professor and associate dean for experiential learning and innovation in the School of Nursing at the University of Northern Carolina in Greensboro. Audrey is also a member of the GRNEN leadership team and a founder. Audrey's clinical and research interests include nursing education, rural underserved populations, and evaluating methods to improve access to care in the US and globally, emergency medicine, disasters, preparedness, and response, engaging communities, and international health and nursing history. She is a dynamic education and healthcare professional with 35 years as a nurse and 20 as a nurse practitioner. She's certified and as an acute care and family nurse practitioner and gained a PhD in nursing from the University of Virginia. Audrey is president of the International Rural Nurses Organization. All right, so without further ado, I will hand it over to Audrey.
Thank you, Kristen, and welcome to all of our attendees tonight. You now know a little bit about me and where I am located. I am speaking tonight to you from my home in Browns Summit, North Carolina, and I'd like to know a little bit about you. So we are going to do a little poll this evening, and I would like to know in general, what part of the world are you from? So we'll give a minute for everyone to take an opportunity to vote. If for some reason you can't see the poll and would like to still share, you could type in the chat box with us as well. I'm going to go ahead and end our poll. And as we can see, the majority are from North America, so Canada and the US. We have an attendee from Central and South America, one from the Asia Pacific region, and someone from somewhere else not listed. Perhaps you would type in the chat box and let us know where you are from. Let's see. Victoria, Australia. Wonderful. Well, welcome. Thank you everyone for being with us this evening. As Kristen said, please feel free to use the question and answer boxes and the chat box to communicate with us. She'll be monitoring those while I am speaking, because sometimes it's a little bit challenging to see them at the same time that you are talking. Someone else said they responded Asia Pacific, but they're in Victoria, Australia also. But someone from Southwest Utah also joined us. Well, thank you so much for chatting in the chat box and letting us know where you are from. So tonight's presentation, or morning, depending upon where you're at, those in Australia, it's probably wee hours. So our objectives today are to describe the role of public health nursing leadership in the community and to apply the role of public health nursing to education of the public during the coronavirus pandemic, which is still ongoing. When we think about public health has three core functions. There's assessment, assurance, and policy development. And if we apply this to the coronavirus pandemic, assessment is identifying cases, looking at possible causes, giving assurance to the public to help decrease panic, to increase knowledge, and then policy development to help decrease the transmission associated with the virus. There are 10 essential public health services that nurses play a role in. And this slide comes directly from the CDC in the United States. So 10 essential public health services. One is monitoring the health of a community or a population. Two is diagnosing and investigating the health problems. The third is to inform, educate, and empower people. And we know that knowledge is power. So having accurate information that people can make informed decisions for themselves with. Mobilizing community partnerships. And we've seen a lot of that happen during the coronavirus pandemic, at least in our area. And developing policies that can help guide what we need to do, that can help protect people's livelihoods and help ensure health for the most number of people. Enforcing laws and regulations. Linking people to health services, and this has been key during the pandemic, as there are people who have other health concerns and they still needed to be assessed and treated for those concerns during a time period when people were afraid to go to the emergency room or afraid to see a healthcare provider. Assuring a competent workforce that can continue to care for people who are ill. Evaluating the quality of health services that are provided, and then providing research for new insights. And we know one of the big things that came out in the United States related to policy was the ability for telehealth services to exist without them having to adhere to some very critical specific guidelines previously that had been issued. And we're now coming out of that guidance to where the old rules do apply, but we're hoping that with the changes that occurred with the pandemic, that we'll see a change in the future in how telehealth services are covered. So public health specifically, when we look at public health nursing specifically, you know, the textbook definition is the practice of promoting and protecting the health of populations using knowledge that comes from not only nursing, but social and public health sciences. It's a specialty practice within nursing and public health and focuses on improving population health by emphasizing prevention and attending to multiple determinants of health. And more recently, we know there's a big focus on social determinants of health. Many times public health nursing is used interchangeably with community health nursing. And this nursing practice includes advocacy, policy development, and planning, which addresses issues of social justice. When we think about public health and doing public health nursing diagnoses, that's using the nursing process within the context of placing the community or population at the center of public health nursing practice. So that shifts from an individual client to individuals as a group, families, larger groups, the community, or a full population. And I love this diagram. This is Friedman's pyramid. And when you look at this pyramid, if you think about the things at the bottom, These have the largest impact on health, going up to the smaller impact. And what we see is that every rung of this pyramid actually has been focused on during the coronavirus pandemic. Public health nurses traditionally have focused on the things on the bottom. And so a key foci of public health leaders, including nurse leaders, has been to look at this. So, with our socioeconomic factors, poverty plays a significant role, and education and potential lack of education to understand a lot of the information that was rapidly being fired out to the public when this pandemic began. Housing concerns, which is why here in the US, there was policy development to keep people from being evicted because they had lost their jobs and could not pay for their rent. Inequalities that occur because of where a person might live, race and ethnicity being a factor. And as we go up the ladder, when we look at, how has public health nurses changed or addressed, starting with the socioeconomic factors, focusing on getting into communities of color to ensure that those communities can get vaccinated, for example, with changing the context to make an individual's default decisions more healthy. In general, public health nursing will focus on healthy lifestyles, eating healthy, exercising, not smoking. Big focus with the coronavirus pandemic on people who were overweight, as that being a critical factor in more serious illness associated with the virus. And then we go up to long-lasting protective interventions, which is, immunizations and the rollout of the COVID-19 vaccine within our countries. And then clinical interventions, which would be, the testing to see if people are positive, and then doing the screenings and contact tracing to ensure that you can capture those people who may have been in contact with someone. And then, of course, the supportive treatment that is being done, and ensuring people are referred if they are sick to get the appropriate treatment, whether that be in a doctor's office or in a hospital. And then, of course, the counseling and education. And so much has been done from a public perspective to focus on hand hygiene, cleaning one's home, wearing masks, keeping 6 feet apart. All of these things with, the public health leaders, including nursing, to look at strategy development, assessment, assurance, policy development, to address each rung of this pyramid that you can see, with all of them having an impact on impacting a population's health. It's been really important during the COVID-19 pandemic to focus on what are the priorities, and preservation of life and mitigation of the spread of the virus has been really important. Having continuity of our government, looking at public safety and order during an event like this. That's the same thing as if we had a natural disaster. That's a key part of public health. Preserving systems, so the commercial systems, our business systems, the nonprofits that are out there who many thought that they would go under with the pandemic, having, from a legislative perspective, money infused into the different areas to help keep organizations afloat, ensuring that critical infrastructure is preserved. And then crisis stabilization, so that there's regression of the disease and that we can see a coming out of the pandemic as we have thought earlier in July. We'll talk a little more about that. And then trying to transition to pre-incident conditions. And I'm not sure that we'll ever get completely to where we were pre-pandemic, but maybe we'll be in a better place. Let's do another little poll. Kind of like to see, and I apologize, I don't think I shared the first poll results with you, but those were the results. I did verbally speak to those. So do you believe that COVID-19 is controlled in the area where you live and work? If you'll answer our second poll, I'm curious what you think. So I'm going to end our poll and share those results with you. So of the respondents, 57% said no, and 43% said yes. And even in areas who have thought that the pandemic is controlled in their area, many of them are seeing some shifting changes over the last couple of weeks that may say that the virus is not under control. I get concerned of us ever being able to fully get there, to be honest. And we'll talk a little bit more about some of the data that's out there currently, especially with the Delta variant and where we're at today with the pandemic. And I see someone said, yes, but only in the immediate area that they think that it's controlled. And, you know, there are some pockets, I think, where that it definitely is, but we will have a little more conversation about that. You know, some of the big focus has been on the impact to children with the lack of socialization, attempting to learn online, children attempting to learn while parents are working from home, getting people back to work, reducing the impact on vulnerable populations. You know, early on, there big focus on our congregate living settings, whether that is long-term care or college dormitories, our seniors who were most impacted early on, and then the geographic hotspots that have occurred out there, as we saw in the US, you know, early on, New York, California, the Navajo Reservation, for example, and more recently, hotspots in India, the Delta variant being highly transmissible there. And then the increase in cases most recently in Europe, with 95% of those cases being the Delta variant. And then in the US, there was an article that came out just this afternoon since I had my conversation this morning with another group. And that was that over the week leading up to the 20th, there was a significant increase in the number of cases over the week before. And 3 states in the US control about 40% of those cases. And that is Minnesota, Texas, Florida. So I did see a note in the chat where someone said we won't occur until we've achieved widespread vaccination globally. And that is correct, because even though parts of the US and in the United States, if you take the whole country, we've hit that 70% mark. But if we take individual states and look at them, because some states are doing a lot better, that's how we've gotten to that percentage. But I'll share data on my state and show you how dismal it is. And it's not just our country being fully vaccinated, but every country in the world getting to vaccination rates. Currently, Africa is at 1% vaccinated. And so that means many of them are the healthcare workers who are not vaccinated as well. And that's a major concern, because if you lose the majority of your healthcare providers when there's already a worldwide healthcare provider shortage, this is going to lead to further shortages and other challenges with other health concerns, even if we come out of the pandemic. So it's important, especially with worldwide travel, people getting on planes and going everywhere. It will continue to have transmission. I'm sure you've been following the Olympics in Japan and the increased incidence of cases there and transmission even among our athletes. And it's a little bit scary, I think, if you look at it from a numbers perspective. So let's talk a little bit about the public health strategies that have been utilized. Surveillance, you know, actually tracking when people are diagnosed with a positive test, looking at who they've been in contact with, early case finding, after early detection, early reporting, prompt medical care for those persons who may have symptoms, isolating people. And this has been really challenging, especially in multi-generational households or in households where that multiple families are living together. In some countries, that isolation is removing the person to rented hotels and keeping them there with there being a guard so they can't leave their room, food being delivered, them being checked on daily by a healthcare professional, and ensuring that they are continuing to have their healthcare and physical needs met while they're in isolation. Testing, and with testing, there are concerns about access. So how can someone get tested? Where do they get tested? That's become a lot easier today with some of the programs that are online where you can easily search and tell. And then of course, equity related to testing so that there's not cost and that persons of color or marginalized populations may have greater chance of being tested to be diagnosed. Some of the other public health strategies has been, as I mentioned, contact investigation and tracing. So that timely investigation, timely quarantine, ensuring adherence to quarantine. And it varies by country as to how this is done. It varies in the US by state as to how this might be done. And then prioritizing high-risk settings and roles is also very important. And I see from Ron in the chat box that enforced isolation is the Australian strategy, and that's been moderately successful. I will tell you that I've done work internationally in the Federation of St. Kitts and Nevis, and early on, for months, they had only had 23 cases total of COVID-19. And this was usually when people were repatriated to the country from other areas after they had been stranded for extended periods of time. But a few weeks ago, I guess it's probably been now about 4 weeks, a month, they had someone enter the country illegally, meaning they didn't enter through a port to follow all the proper procedures by air. They came in by boat to an unauthorized port, and they were COVID positive and spread that to a school child who then spread it within their school and to other families. They had to completely shut down their school system for a couple of weeks. And now their case number has gone over 500. And that's because of one person and their activities. So we know that public health and creating policies, which many times people do not like, is key to try and mitigate the risk. And I think about island nations such as those where there's indigenous population that easily can be decimated, similar to what happened on our Navajo reservations in the United States. Some of the other strategies has been the focus on social distancing. These policies and practices that help reduce the community exposure. So we've seen executive orders by governors, by presidents. We've seen education and social marketing campaigns to really focus on things like the use of masks. And we've seen various changes in that mask mandate over time. There's been some significant focus on vulnerable populations and trying to reach with different types of messaging those vulnerable populations to try and decrease their risk. And then of course, practices and policies that reduce workplace exposure. So helping organizations have policies and practices in place, having the ability to screen within the workplace, and then having exclusion criteria when someone cannot come into work has been really helpful. Trying to do appropriate medical management has also been challenging. As you saw early on in this pandemic, there being tractor trailer morgues, refrigerated units sitting outside the hospitals in New York City. Trying to predict, plan, prepare for there being a surge of patients, and at the same time, having enough equipment, having enough ventilators, having enough physical work power to be able to, workforce that can care for those patients, trying to address those staffing issues. And we saw, travel nursing, that there may be people who they worked in a clinic and their clinic was closed. So then they didn't have a job. So they signed up with travel companies and they traveled to other parts of the country or the world to actually provide healthcare. And then, of course, seeking and receiving the appropriate level of care. So the use of telemedicine, screening people who had symptoms prior to them actually physically showing up at a facility so that you could give them information about the closest testing site, depending upon symptoms, determining if they could be seen in primary care or if they needed to come to the hospital for hospital-based care because of oxygen saturations being really low, difficulty breathing being a major problem. And then, of course, planning for that vaccine distribution. And of course, hindsight is 2020. There was great planning related to the development, manufacture, and distribution potentially of the vaccine, but not the boots on the ground distribution of the vaccine in many, many areas. And there are some lessons learned there on how we could improve that process and could continue to improve. Some of the guiding principles have focused on access, transparency, there being equity in vaccine distribution, efficacy of the vaccines, and that being publicly available information, as well as knowledge about the safety of the vaccines. And I think that's been one of our biggest challenges here, is that it's still under emergency use authorization. If we look historically at vaccine administration in the United States, many of the vaccines given to our children initially had studies that included 6,000 people. And we now have studies that were done for emergency use vaccines that had over 25,000 people in those studies to look at the efficacy and the safety of the vaccine. Worldwide, these are trends as of today. There's been over 192 million cases of coronavirus, over 4.1 million deaths, and you see the number that's recovered. And so the scary part is the difference between the 192 and the 175, because those are people who are still sick. And we know that many persons have developed what is now termed officially long hauler syndrome. They may have neurologic changes, continued brain fog. They may have continued respiratory impairment. They may have continued cardiovascular systems and symptoms and issues. And all of these have made it difficult for them to be able to consider going back to work, to be back to a healthy environment. I know that locally we actually have a COVID-19 clinic with the goal of assessing patients. It's open in the evening time several nights a week to really allow assessment of people who have been hospitalized and who have been discharged, to try and prevent their re-entry into the hospital, or to get them back into the hospital if their symptoms are significantly worsening again. Now, here in the US, just to give you a look, and the United States continues to lead the world in the number of cases. And that to me is very sad for an industrialized country. But we're at 35,625,000 deaths, and there's been recovered 29 million. But again, that difference between the two is something that we really need to pay attention to. Now, I like the Worldometer site. I look at it every couple of days. When we were in the heat of our pandemic, I was looking at it daily. The other site that I like to look at is the COVID Act Now site, which gives you the opportunity to actually look at a state, a region, a county, and really see what the rates are. So I'm going to give you just the state I live in. Daily new cases, 9.3 per 100,000. Our risk in our state is very high for transmission. And with this, the goal would be to see less than 5 new cases per 100,000 people a day. The infection rate is 1.33, which means that for each person who gets COVID-19, they're transmitting it to 1 1/3 person's average. And we would like to see this be less than 1. The positivity rate is at 5.5%. And we would like to see this down to less than 3%. The percent vaccinated, and this is very disappointing, is only at 50% with 1 or more doses. And this just happened this week. We were at 49% for weeks and weeks and weeks, and we just hit the 50% mark. And this doesn't include our children in this, since they're not eligible to be vaccinated yet, only 16 and above. I like the trends that you get with COVID Act Now on cases. As you can see here, the number of cases going up again in the last 30 days. I saw lots of pictures from around the world, around the US from the 4th of July celebrations. And when there's the focus on the doubling of cases from 1 week to the next, that's almost 14 days after the 4th of July, that we're seeing that increase, and wonder how much transmissibility or transmission happened during the 4th of July celebrations. Hospitalizations, as you can see here, has kind of gone down and up a little bit, but trending upward again. And then deaths, we had gone way down and now we're coming back up again on deaths. What we see is that 95% of the cases that occur currently are related to unvaccinated people, but that does mean that 5% of the cases are in vaccinated people. I currently know 2 nurses who are fully vaccinated who did get COVID, and it was not just a mild case or asymptomatic case. They were both out of work for about a month. So it's really important to consider, there may be regional, you don't need to wear your mask anymore, there's no mask mandate, but I think it is important for us to consider and make individualized decisions based upon what the data is in our area. So I'm not going anywhere indoors without a mask on in my region because of the data that I just shared with you based upon this site. So let's do another poll. What percentage of people are vaccinated for COVID-19 in your area? I told you the continent of Africa is at 1%. The US is at 70%, but that's for the country as a whole. Here in my little area of the world, it's only 50%. So I'll give a couple more seconds and see if people respond. And I'll share the results with you. So what percentage of people are vaccinated for COVID-19 in your area? What we see from your poll is one person said in the 10 to 25%, 3 people in the 25 to 50%, and 3 people in the 50 to 70%. So not people up at 90 to 100. At least here in the US, the push was to get to 70% in order to have, they thought, herd immunity. We needed to have minimally 70% vaccination rate in our area. So when we, I'm just going to check the chat box. Around 13% fully vaccinated, but around 35% first dose. And so that's in Australia. Thanks for sharing that, Ron. Assessment of vulnerable and high-risk persons. When we started out with this, what we saw based upon the numbers of who were getting critically ill and who were dying was the older adults, so over the age of 65, men more than women, racial and ethnic minorities higher than your Caucasian population here, at least here in the US, then persons living in nursing homes or long-term care facilities, and then persons with underlying medical conditions. So if a person had asthma or a heart condition, diabetes, if they were immunocompromised in any way, chronic kidney disease undergoing dialysis, liver disease, or severe obesity. My husband is also a nurse, and he works in a dialysis outpatient center, and they lost 40% of their population. Now, because of patients who were really sick in the hospital, many of them developing renal failure, they're increasing their population in the clinic again. But to think that you've lost 40% of your population related to COVID, it's pretty scary numbers because of them being at such high risk. Severe obesity was a major factor, as we've talked about. So what's the vulnerability today? Today, it's the unvaccinated. And public messaging. Every nurse, I mean, I put things on my social media pages. I try to reach out to family and friends. My aunt died early on in the pandemic. She was in a long-term care facility. She was 94 years old. She had COVID. She was admitted. They did all the right things. But when she went back, was transferred after she was doing a little bit better, she relapsed. And she decided, I don't want this. She did not want to be reintubated, did not want to be severely ill in the hospital. And so she was made comfort measures. So, I said to my colleagues in the School of Nursing that when this pandemic was over, I felt there would be not one person who had not been impacted in some way by this pandemic. And I know my family has been. My brother worked in a public environment, and he developed COVID and spread it to his whole family, including all the grandchildren that live with him. So fortunately, no one died, but people have been really, really ill. So our unvaccinated are immunocompromised. And, I feel like we need to get everybody to get vaccinated so they can help protect those people who are immunocompromised. And then, of course, our children, as I mentioned, who are not able to be vaccinated yet. We are hoping that this fall there will be emergency use authorization for children who are less than the age of 12. So we'll see what happens. I know it's variable by country, and vaccine availability is greatly variable by country. Vaccine distribution, and that's also really challenging because how you have to store it, how long it can be out of refrigeration or out of the freezer. When we started our vaccine clinics on our campus, we started out with being given the Pfizer vaccine. We gave Pfizer vaccine for 1 week, and then they changed us to Moderna, and we gave that for 1 week, and then they changed us to J&J. And so we had experience with all three vaccines that have been approved in the United States for emergency use authorization. But talking to colleagues around the world, it's been variable as to how effective the vaccines are thought to be and how easily they can be gotten. I have colleagues in Kenya who are in healthcare who have yet to be vaccinated, and they have limited travel because of that, so that they try to not pick that up. We had a global exchange in the fall, and one of my colleagues there actually had a nursing student who came back from the rural village, and they cut their nursing unit numbers in half. So they had 4 students in a nursing unit, and that nursing student came back with COVID and gave it to the other members of the group. But that sentinel student actually died. They had a history of asthma, and this was a very young person. So it's had a major impact on potential future healthcare workers, besides, workers around the globe. So we talk about public health's role in assurance, having the availability of testing, advertising those testing sites, assessing their capacity to test early on. We saw on the media long lines of cars lined up to be able to get tested. Now it's a lot easier. There are sites where, at least in my region, you can log into a web page and you can put in your zip code and it will tell you where you can get the vaccine. It can tell you where you can get testing closest to you. And all of the testing and vaccines are free currently in the United States. Tracking utilization of the vaccines. And this is something that was really meticulous in our area with operating a vaccine clinic. We had to account for every solitary dose that was given to us. Then collaborating with businesses, churches, community groups, and of course the higher education system. We have seen Ohio was the first state to enact there being a lottery. So if a person had been vaccinated by a certain date, their name was put into a lottery to receive $1 million. North Carolina followed suit. There were 2 lotteries in the U.S. in North Carolina. One was related to adults being vaccinated, and then there was also a education lottery for those who were 16 and above who were not eligible to enter the other lottery. So things are being done this week. There are several sites where they will give a $25 gift card to the person being vaccinated and a $25 gift card to the person who drives them to be vaccinated. So again, trying to look at incentives that can be done. We did a lot of work with our parish nurses and actually going to the homes of people who are not able to get out to get to a site to be immunized. Lots of businesses have put in incentives. We'll give you a day off if you get vaccinated. And others who have said if you get sick from getting the vaccine, we'll give you that time off and still pay you. So there's been lots of things that businesses have done to try and increase the promotion and uptake of the vaccine. And then, of course, policy development, having these health directives, which have changed. And early on, there was a lot of confusion because there was not, at least here, good centralization of data and information, and that has improved over time. And of course, the business frameworks to try and ensure that businesses could stay open, that there would be fiscal support for businesses to continue to operate during this pandemic, and for people to be able to pay their electric bill, pay their rent, etc. Public health nursing does a lot on community education. What you see here is some of the bulletin boards in one of the schools that we collaborate with. This was done by our nursing students to help increase information about mask wearing. We just received our governor's update yesterday that starting for the fall semester, K through 8 should all be wearing masks, and our high school students, if they're fully vaccinated, do not have to wear masks in schools, but it's up to the individual schools based upon the data for their area to determine with a Healthy Schools Toolkit what should be done. Then education, of course, on spread of germs. And like I said, we got our nursing students involved because there has been a shortage of healthcare professionals. We know over the last 10 years, at least in the United States, that public health has been cut as far as funding significantly. And so nursing students can play a key role working with our public health nurses to increase that education. There's also, the key things that needed to be spread, signs and symptoms. How is it transmitted? How do you prevent it? Guidance on quarantining, especially if you've got a 6th person in your home, but there's only one bathroom, and this is, a multi-generational household. How do you care for family at home? Assessing risk of activities to try and mitigate risk of transmission, and then how to respond to tracing phone calls, because a lot of people, if they don't recognize the phone number, will hang up and not take it, maybe not even listen to a message, but that could be someone alerting them that they've been in contact with someone who had coronavirus. There was also a really cool app created that you could download onto your phone, and if you had come in contact with anyone who was positive, based upon your route and where you've been, you could be alerted that you had been exposed. It wouldn't tell you who you were exposed to, but it would alert you that you had been exposed and you should get testing done. Now, with mask wearing, what happened to the flu incidents this year? Did you see it majorly fall in your area? We saw some significant drops in flu activity around the country. What was interesting is that as soon as some of the mask mandates started to be lifted, we started to see an increase in RSV, a respiratory syncytial virus. So masks played a big role in preventing some other things from occurring, but potentially also is because more people were being encouraged to get the flu vaccine, because if you became ill, was it the flu or was it coronavirus last fall before we had the vaccines available? Now, I love the World Health Organization's site related to coronavirus, and this one is geared toward the public. And the Mythbusters site on here is really good because it takes everything you may have heard on social media and it tells you the facts about it, whether it's true or it's not. It also gives solid information about transmissibility, how to report misinformation that you might see in the media, how to advocate, what to do in small public gatherings, how to get vaccinated, help you find my vax, will help you do that. Masks, how to make them if you don't have them readily available, and then COVID-19 questions and answers. So I encourage you to look at that site. That can give you a lot of information that you can use with the public to talk about it. We discussed a little bit the flu or influenza positive test results. Now, in 2019, in the United States alone, there were 35.3 million laboratory confirmed cases of influenza. Now, this is from last September up until July the 10th. And what do you see? That is not even a million cases. So we know that wearing masks really did decrease transmissibility of the virus. So, even if we don't have to wear masks, if I'm flying or traveling to another country, I may be mask wearing still 5 years from now, who knows, just to try and decrease the incidence of picking up some germs. The 3 W's was a big focus of education here. Wearing a face covering, waiting 6 feet apart, washing hands frequently. Now, depending upon the transmissibility in an area, the wait 6 feet might be wait 3 feet apart. So it is variable now, but again, trying to educate the public and give them solid instructions with rationales as to why and reasons to encourage them to comply. Face coverings. Of course, people are giving away free masks left and right now, but early on, not everyone could afford a mask or they were not manufactured or available. So teaching people how to use a bandana and make a mask, or how to use a t-shirt and make a mask. And I think this piece is really important. We've been working with the country of Moldova, their sister country to North Carolina, as a city. And we did a lot of work with them, and we even sent over container loads of masks for the healthcare providers because they were not available. And they lost a lot of healthcare providers early on in the pandemic just due to lack of personal protective equipment. Another thing that I'll mention is on the HHS, or Health and Human Services site, there is a COVID-19 Community Corps site, and a lot of nurses have joined this. I joined this to try and get accurate information. Usually once a week, there is a webinar from the Attorney General. We've had Anthony Fauci speak with current up-to-date information. Anytime there's something that's changing related to the coronavirus pandemic, they share clear, accurate information that allows me to feel like I'm on top and I know what's happening in my area, in my world, and can help answer questions. Right before I started this webinar, I got an email from a previous student that said, "Help, I have lots of questions about the vaccine and other things. Can you please call me tonight?" And so when we're done with the webinar, I'll call that student, previous student, and see what information I can help them with. So I know that this evening we have shared a lot of information related to how public health and public health nursing has responded to the pandemic. And I think that many times nurses have been frustrated. I know I personally have been, when there's been conflicting information provided and then misinformation provided. But I think we can all, in our own little part of the world, do our part to try and ensure accurate information and dissemination of information. In my school, I took it upon myself to do a weekly newsletter to disseminate information to all of our faculty, staff, and students, so that it was everyone hearing the same message. And also to try and increase resiliency during this pandemic was also very, very important. There's a few references that are on the reference list that are there, as well as the Worldometer and the COVID Act Now site and the HHS site, which we talked about as we looked at that data from those areas. What I'd like to do now is open up the floor for questions, and then I would like to share with you some information about GRNEN and some ways that you can become involved with us. So I'll just take a quick look at the question and answer and the chat box just to see if there's anything there. We know that in many parts of the world, this virus is still running rampant. And I think that it's important, as we consider, I teach study abroad, and we are having to develop criteria for what would allow us to do a study abroad program this year. I flew for my first time 2 weeks ago, and I flew through Atlanta to Colorado, and I flew back from Colorado to Charlotte, North Carolina to Greensboro. And I felt much safer actually in the airports and on the airplanes than I have in the general public, because everyone was mandated to wear their mask and everyone was complying and actually doing it. I'll just give it a couple more seconds, see if any questions pop up. And if not, I'll go on to talk with you about some of the great things that we're doing with GRNEN. So our Global Rural Nurse Exchange Network has been working really hard over the last year to try and look at how we connect nurses from around the globe, especially to focus on rural nursing and rural nursing care. We have developed an ambassadors program, and we are currently accepting nurses, nursing students, and we are looking for people from all regions of the United States as well as internationally. We would like to have global representation with a goal of allowing these ambassadors to help steer our future direction for the Global Rural Nursing Exchange Network and our initiatives, because our leadership team would like to have input. We would like to expand our network by discussing ideas, recruiting new members, and I will say that there's no cost for this. Currently, we have foundation support that has allowed us to do these initiatives. We'd like for our members from around the globe to share their experience with other rural nursing advocates. And we're going to value our ambassadors because you have insight into your country or region's culture, the politics, the health systems, and the people, as well as rural nursing experience, teaching practice, and research ideas. So the benefits that we see for a person becoming one of our ambassadors is the professional networking and that opportunity to build a global profile. Also support from colleagues all across the globe, and the chance to make connections for both research and education development. And then visibility for your community's rural health concerns, as well as resources to help you develop leadership skills that could positively impact your community. So we're asking for ambassadors that will help support us from now through the end of the year minimally. We're launching some storytelling circles this fall, and would like to have you participate in those. We're going to have some monthly podcasts on our website, as well as having research and practice monthly open spaces where you can sign up to lead a discussion topic or share something of importance. And then helping us to disseminate information about our next 2 webinars. Our first webinar was 2 months ago, and that is available on the GRNEN website for anyone to listen to. Today's webinar will be available after it's processed and up on the website. And then networking tools go live. We are in the process of developing networking tools that can be also app phone-based as well as web-based. So Mark has asked, how do we register to be an ambassador? I don't see a link for an application on the website. There is on the ambassadors page, should be near the bottom, a place where you can put in your email and your contact information. And if you're not finding it, you can email info@GRNEN and we will get you signed up as well. Our website is grnen.org. And on this website, you'll learn about our founders, the leadership team, news that's been going on, events. We have some videos on the site of rural nurses talking about their work around the world. And we would love to have you share with us so we can share with the world what you're doing as well. I see another chat box now has that information on the ambassadors program. And as I mentioned, we are working on an app solution for our Global Rural Nursing Exchange Network. There will be a user interface where that it can be on the computer or your phone. And we're looking to publish nursing information as well as have a learning management system for continuing education and education opportunities and content that might be videos or audios or documents. And then this part, I think, is the most important part, a discussion board where you can post messages and subscribe to the message board or reply to the message board. So let's say in the middle of the night where you're practicing, you have a question and you want to know about policies and procedures for something. And if that's the case, you could put out a message and perhaps someone else is getting a little ding on their app that says, hey, someone has a question in Kenya. Can someone else answer this question? And maybe you have the answer and you could share that information readily. So we want to ensure that there's a way for members of our network to communicate. And I'd again like to reiterate that we have foundation support, that the development of the app, the management of these programs is being covered currently by that foundation support. So there's no cost to sign up for our newsletters, to receive information, and then to choose what you would like to be involved in. Now, with this platform, as I mentioned, our plan is to house research and presentations, have some co-learning spaces. My goal is that as we have students in school, they can use this as a way to communicate and to learn together. It's a way for the discussion boards to allow natural relationships to grow, and that we can have some virtual group discussions and exchanges on things that are really important to rural nursing, as well as acknowledging the importance of diverse global perspectives and providing deliberate learning opportunities that foster and increase worldview intelligence while addressing those important questions, topics, or challenges that you might have. We're also hoping to facilitate identification of nurse leaders in different cultures around the world and provide an opportunity for them to connect. And then having a place where nursing students can experience other cultures without traveling. We do know that if students have exposure to rural nursing while they're in school, they're more likely to consider a rural nursing environment to work in when they graduate. And we know that our rural environments really need nurses there. So thinking about how we can have some co-learning assignments that students in 2 different countries could work together to design a health intervention, and that there could be group discussions and projects. So again, a platform that nurses, researchers, educators, and students can all use. And this is our goal. We're hoping that within the next 2 weeks, it will be launched. So we'll send out some emails when that actually occurs so that we can encourage you to join with us. We're hoping our ambassadors will test it out first for us and let us know how it's working and give feedback so that we can have some quality improvement associated with that. So what's the implications for the future? You know, the framework developed through this initiative will help support the identification of best practices surrounding rural global emergent experiences, the creation of global communities that support dialogue and learning. It'll develop methods to expand the audience and facilitate critical dialogue and knowledge creation regarding rural culture and healthcare delivery, and enhance the opportunities for networking and connecting with rural nurses around the globe. And with that may come research partnerships, practice innovations, potential educational opportunities. And I suspect that the Delta variant impacting our pandemic means that we'll not be traveling as much for global exchanges in person, and this may be a way that that can occur naturally. Let me just check our chat box one more time. So the chat box does have information on how you can reach out to us. Again, I'd like to thank you for being with us this evening or morning, depending upon where you are. Remind you that it has been recorded and you can find it on the website once it's processed and up. And if you have any questions about today's presentation, please reach out to us. If you have any questions about anything we talked about with GRNEN, please, again, reach out. We hope to engage you. Follow us on social media. If you go to the webpage, grnen.org, you'll see all the little icons in the upper left for social media. So regardless of what platform you use, hopefully we're on there. And if you use a platform and we're not on there, please email us or message us at the info@grnen so that we can explore that as an option, because we know in different countries, there are different platforms that are being used. So I will stay on for a minute in case there are any last questions. But again, thank you for your time today, for sharing with us, talking in the chat box, and for disseminating the information that we've shared with you today.
Thank you so much, Audrey. I do want to mention before everyone hops off, we do have another upcoming webinar as well, a global rural collaboration, student nurses engaging with community health assessment, sustainable education, the model to reduce health disparities. And if you'd like to register, just go ahead and go to our website, grnen.org/events, and we'll have many more exciting things coming up soon. So make sure to follow us.
Thank you, Kristen.